Okay, Steele, welcome to the people of Utah.
Thank you, James. I'm very happy to be here.
I'm excited to see you again, man. It's been, let me think. You graduated 2018, I was 2017, so almost 10 years since I've seen you.
Just about, yes, sir.
That's awesome, man. So, loaded question. What have you been up to for 10 years? Why don't you give me like a short, super high level view, and then I really want to get into some of the details.
Yeah.
Some of the creativity.
Yeah, man, absolutely. So after high school, I wanted the original plan was to go into med school. I wanted to be a doctor. That was plan A. Plan B, nurse practitioner, just in case. But due to extensive complicated medical history, I couldn't pursue conventional university. I just couldn't. There wasn't any way that I could make it work physically, mentally, and financially. So I kind of just had to work with what I had at the circumstances with what I was working with, and I had to pivot. And so what that usually looked like is that I worked as a medical assistant for a while. There was a nice family doctor who brought me in and let me work under him. He taught me as I worked, which was nice. And it was very low stake. It was easy on my body and mind and everything. And I did that for a while. And then I somehow wound up working at behavioral correctional facilities for about 4 years, primarily working with youth, young men. So like places like Discovery Ranch, that type of a thing. And then I started studying holistic Eastern philosophy of medicine because I still wanted to be a healthcare practitioner. I just knew that it wasn't going to be in the traditional sense. And then that's when massage therapy came in my periphery, and it just felt like that puzzle piece that just clicked naturally. You know what I mean? And I found a school. It's a 1,000-hour program, and I've been licensed and practicing for 3 years, and I absolutely love it. I think it was Friedrich Nietzsche that said that the two most important days of a person's life is the day that they're born and the day that they find out why. Being a licensed massage therapist is definitely one of those whys.
That's awesome, man. Yeah.
I can't complain.
That's great. Yeah. So it sounds like it meets, some of your kind of deep goals you had for a while, which was to do something to benefit human health and stuff.
Right.
And then also involve like holistic type of feeling, which is very interesting.
Absolutely. And health, wellness, it's multifaceted. You know what I mean? Which there's a lot of moving parts.
Yeah.
It's not only just your physical body that you need to attend to, and all of the many different facets that exist just purely with your physical body, but your mental health, your spiritual health, your energetical health, you know what I mean? And it all is important for the sense of whole,
Yeah. So, well, I'd love to get into some of that stuff. Let's start first with your journey with your health. You said that you had some health challenges that prevented you from the typical university scenario.
I did, yes, absolutely. And not only did it prevent me from just the stereotypical university scenario, it quite literally sutured, cut away my way into most traditional way of things. So let's, take it back a couple of years. 2017. I was writing the high sophomore year. I was involved in a lot of extracurricular activities. I was a year-round athlete. I was in a great relationship, and I was excited for my junior year. I was really looking forward to it. There was great prospects in front of me, and I couldn't wait to jump in. I was junior class president-elect for that year as well, so I was really excited to get involved in things in a more intimate and real way. You know what I mean? So started going into the junior year, going in strong, and that's when I started noticing things slowly start to shift, and they shifted in a very subtle way. There's a difference between tired and being fatigued, right? Tired was to be expected, right? Like, we've all been tired. It's one of those things where it's a long day, you're involved with a lot, but after a good night's sleep, the tiredness goes away, right? Fatigue, on the other hand, is something else entirely. It's like a toolbox was put in the way between your body and the energy reserves that it needs to be able to operate. And there's just something that is preventing it from getting it for what it needs, right? That's how the best way I would describe fatigue and the particular type of fatigue that I was going through. And that just kind of was a slow burn up until, Christmas break is when it really started getting the worst, and with the symptoms and stuff setting in.
So coming into your junior year, you started noticing symptoms and stuff that had progressed, because that's like August, school starts, so a couple of months, and then Christmas break comes.
And Chris,
Were there any other signs besides the fatigue?
it was just the fatigue, just
Way tired all the time.
way tired all the time. Yeah, and it didn't help cases either, because my freshman year, I got diagnosed with mono. And so mono is one of those things that kind of just hangs around in your system forever, and it has reoccurrences. So me and my family and everyone else around me just thought, oh, it's just a reoccurrence of the mono. You know what I mean? And so, but the fatigue eventually turned into exhaustion, and I started losing color. Cheeks and eyes started to sink in. I'll never forget that one day in history class when I can't remember her name. I can only remember what she looked like, but there's this one girl who noticeably drew attention and openly said, he does not look well. He looks really sick, But I just kept on with that mindset of, it's just mono. I'm fine. Don't worry about it. It will eventually clear up like how it did before. But I woke up one morning, and the lymph nodes underneath my left armpit had swelled up to the size of roughly about a tennis ball. And that's when I knew, deep down, that there was something else going on, and it was bad, horrible. And so we ran over to the family doc, and it was funny. He didn't even really examine me. I explained my symptoms to him. He took one look at me, and that's when I first heard those words that everyone, I think, kind of just dreads and hopes and prays that they never have to hear. And the way that he phrased it was, I'm afraid that your blood is not operating in the way that it should. I am afraid that you might have leukemia or lymphoma. And my only response to that information was I laughed. I laughed in utter disbelief, considering the fact of how active I was, the meal plan that I was on. By all accounts, it did not make any lick of sense for that to be what happened.
So this is at age 16?
This was the same month that I turned 18. Yeah, so birthday is on the 5th of February. My official diagnosis was on February 23rd. Wow. 2017. Yep. But we couldn't confirm the diagnosis there at the family practitioner, so he referred me over to the oncologist clinic over in Provo. And so I remember that drive home very vividly. Mom is just, weeping in tears. And I remember comforting her in that time, where it was like, hey, I know it was news, scary, terrible, but we haven't gotten the official test done yet. So, let's hold off as much as we can.
Did you get to go to Provo the same day, or did you wait a little bit with that fear?
You're right. So it was a couple of days, because that was the soonest that they could get me in.
Yeah.
And, but he did say, if he loses consciousness at any point for any considerable amount of time, then you take him immediately to the emergency room type of a thing. My dad and he was wanting to spend some time with me, the time to kind of talk about the appointment and everything. And so he said, come run some errands with me. We'll get breakfast, that type of a thing. And we sat down at the booth waiting for the waitress to come take our order. And the moment I sat down, I laid my head on the table, and it was lights out.
Wow.
And the only thing that I remember after that was that I was in my dad's truck and we were pulling into the emergency room at the Provo primary healthcare facility over there. And the Intermountain facility is what I'm at. And I asked what happened, and he's like, "You blacked out on me. You were unresponsive. I didn't know what was going on, so he drove me immediately here." And he filled me in a little bit more. He got off the phone with the family practitioner. He's like, "Yeah, he needs to be seen immediately. It's way worse than I thought." And so, and that was the first time where, I'm sitting in an oncology clinic. The last place any 18-year-old would think that they would be. Yeah, dude, you know what I mean? It was very surreal. Absolutely. And then they took us back. They drew my blood, and the numbers were they were horrifying. White blood cell count was astronomically high. Red blood cell count platelets was abnormally, unnaturally low. The doctor, he came back in, he gave the results, and my hemoglobin level was at 0.5%. Now, to add a little bit of context to that, a normal healthy person that ranges anywhere between, they're usually sitting around 18 to 20 is within normal healthy parameters. I was sitting at less than 1% type of living. And he told my dad where it was like, if we would have waited another 12 hours to get seen, we would not be having this conversation.
That is crazy. I didn't know any of this, dude. That's wild.
Yeah, it was. We could not have rode that line any thinner than we did, And so he said, "I gotta go make a few phone calls. I'm sit tight type of a thing. We're gonna get something arranged for you because you need treatment now." And that's when they confirmed that it was in fact leukemia, right? And so it was done deal. I had it, right? He walks out, and I just remember my dad, this very stoic gentleman, hardly ever saw him cry. And there he is, in the corner, weeping. And it's the type of weeping that a parent has when they are wrestling with the fact that they might lose their kid, And as I go throughout telling, my story and this experience, I can't share it without also tying it directly to my faith. Because my faith in God and the fundamental faith that Christ is my savior, it quite literally saved me, James. It did, by every metric. And it was in that moment when I was seeing my dad crying, where he shared, his woes with me, where he's like, "I'm afraid how this is going to affect the quality of your life for the rest of your life," And I just remember feeling in that moment where I had my really first touch with grace. Because as I go back and will think about it now, searching all the rooms in my heart, there was not an ounce of fear anywhere to be seen. Anxiety, nothing. It was calm, peaceful. This presence that was there, that was letting me know, that was shrouding over me and letting me know that everything was going to be okay, type of a thing. And I just told my dad, "Hey, I'm still going to be me. We just got to get through this cancer thing first, And the doctor, he came back in. He lets us know that the primary children's hospital located up in Salt Lake City, that they were waiting for me. And they had a room all prepped. They asked if they wanted to have the ambulance take us up. And my dad insisted that he would be the one to take me. I don't remember much from the drive up there because of how exhausted I was.
Sorry, this was the same day?
This was all the same day.
Okay.
Yeah, the February 23rd, things moved quick.
Yeah, so the diner to the ER to Salt Lake.
To Salt Lake,
Okay.
all in the same day.
Okay.
Yes, say yes, sir. And I don't remember much from that drive other than it was snowing. Not harshly, not aggressively, but, gently type of a thing. And there was a whole medical team waiting for us. They wheeled me up to the oncology ward. They assisted me into the bed, and they hooked up 2 IVs in me. One was to give me a blood transfusion because my blood cells were so low, and the other one was chemo. They started me effectively immediately. And then I remember waking up that next day in primary children's, actually feeling better than I had in months. Color came back. Some of my energy was back. I remember the first meal that I ate after being pulled quite literally out of the clutches of the leukemia had on me. First thing I ate was pancakes, and I will never forget how good those pancakes tasted.
Right on.
Just being able to finish a whole meal. Just because when leukemia is lethal for several different reasons, what makes it one of the more lethal strains of cancers is that it's cancer of the bone marrow. And your bone marrow is your body's blood factory. It creates your blood cells. And blood is vital for life. We simply don't live without it, right? And so it prevents your body from being able to make more, right? Red blood cells are responsible for carrying the nutrition and the oxygen, the nutrients from the food that we eat and the oxygen that we breathe, and being able to distribute it to our major organ systems. That just wasn't happening on my end, right? And it was going on for quite a long time. I was quite literally withering away to nothing, And so that's when I met I became very popular the following day. I met my whole oncology team. I met my head oncologist. I met several other oncologists, the teams of dozens of nurses that were responsible for taking care of me, social workers, a primary caretaker, you name it.
Okay.
And one of the oncologists came in and he started writing, had a big old whiteboard in the treatment room. And he just started writing down my treatment cycle. Every cancer, depending on what it is, how it's diagnosed, where it's located, is going to determine how it gets treated. I was diagnosed with an acute lymphoblastic leukemia, very high risk, which basically means that they caught me very late and it was serious, very serious.
Well, very late, because you were experiencing symptoms for months, right, before you went in. So this is crazy to hear. Everything you're saying is just so crazy. Sorry, keep going, man.
Oh, you're good.
This is wild.
Right? No. And so he writes down, he quite literally maps and charts what the next 3 years of my life was going to look like. Because that's how long it takes to treat the cancer that I specifically had, and some other cancers take about that long. I was under chemotherapy for about 3 years. So from 2017 to 2019, from ages 18 to 21, that's what I was under.
Man, we can't skip over the fact that, like, this is just wild, because one day, like you said, like you're going to school, you're a junior in high school, and then the next day you are saying, hey, here's what the next 3 years are going to look like, right? Hanging up with us here in Salt Lake in this care city. That is just so crazy.
It was.
Like, not only is it crazy for, like, your body and everything that's going through, but just for the mind of a teenager to have all this happen in high school is just insane. So
it was.
It's cool to see you now, and I can't wait to hear you continue the story, but this is just wild.
No, it certainly was a very the rudest awakening as far as adulthood goes.
Yes, instantly.
It was my introduction for sure, and there was no filler, there was no space. It was, you got to grow up now. You don't got a choice, right? And so he writes it all down. He writes the treatment cycles, the type of medication I'm going to be on, the dosage, the timeline, everything. And then he grabs an eraser and he erases it down and he's like, I just want you to focus on this month and what it will entail. And the first time that a body is being exposed to chemotherapy is the scariest. And the reason for that being is that they don't know how a person who's never been exposed to chemotherapy, how they're going to respond. You always hear all the time, either through media or you've known somebody that's had it or whatever may have you, right? That chemotherapy is poisonous. It's terrible. And I do want to take a moment to explain exactly why, please, that's the case. During my time with treatment, I took it upon myself, and I'll get into more of the details as to why I dove headfirst so straightforward as I did about worrying as much as I could about not only the type of cancer that I had, but the history of cancer and the treatment, all the whys. I wanted to know everything. I wanted to know exactly what was happening, why, and what they were doing, and the reasoning behind it, right? So chemotherapy, a lot of people don't know this. The reason why it is so harsh and hard on the body is that it contains compounds that were active in mustard gas, specifically nitrogen mustard. They figured that back out during World War One, when they found out that soldiers, their bone marrow was suppressed and their rapidly dividing cells in the body, the mustard gas would just kill them. It would eliminate all of them. And then World War II rolled around, and then scientists and professors were able to get their hands on it, experimented with a little bit more, and cancer was still very much a prevalent problem then as it is now. I mean, there's been advancements with things, and it's not as grim as it was back then, but the cancer is defined by uncontrollable cell growth. It just cells that, and that's the $1 trillion question, on the DNA level, on the genetic level, for whatever reason, the cell decides to, an error doesn't get catched, and it mutates. And it grows to be 2 times to 3 times larger than normal cells in the body, and it cannot stop dividing. It just doesn't stop. It quite literally will go and go and go until it kills you. And so they were looking at the effects of mustard gas on these soldiers, and they were thinking, hey, if we could fine-tune this, maybe we could use it to treat cancer. And thus chemotherapy was created.
Interesting.
And so it is wildly interesting. But that is why it is so hard on the body. And going back to specifically, the 30 days where it's being exposed for chemo for the first time, they don't know how your body's going to respond. There's a few different ways. There's the one way where your body just rejects it outright. It can't handle it. It can't handle the strain, right? And so they just simply can't give it to you because the treatment itself would kill you if they continue to give it to you. The second reason is that the cancer cells simply are resistant to it. They're not responding. The division is still happening. And unfortunately, this happens. This happens to people that when they're diagnosed and they didn't seek help and they want to get treatment, some people just simply can't get it because their bodies can't handle the strain, and it's complete luck of the draw, right? So ideal set of circumstances is that the cancer cells respond, meaning that they are being destroyed when the chemo was introduced into the system, and that you can tolerate the side effects just enough for them to be able to continue to get it to you.
Okay.
And so that first 32 days is where they give it to you, your first rounds, and they kind of just wait to see what happens, and they kind of are expecting something to go wrong, some sort of complication, some sort of something to go on with your organs, whatever the case may be, right? They expect something bad to happen, right? And so that thing did happen to me, not in the worst case scenario that they were thinking, but something did happen. I That first month I was there at Primary Children's full time. I just lived there. But there was a period where they allowed me to go home for about a week. And so during that time, I was, I was chewing food, and, we bite our gums sometimes, and typically for a normal, healthy, average person, that's not a big deal, right? Your body goes in, it mends the tissue, right? Not a big deal at all. Well, I was immunocompromised, meaning didn't have enough white blood cells to fight off any sort of bacteria whatsoever, and anything for it. My body didn't stand.
Oh yeah, you're very, very frail. You're very, very susceptible. Right?
Yes, yeah. I had one nurse tell me that even something as small as a paper cut can become lethal, right? And so that site where I vet my gum got infected. It got super inflamed. It swelled up to about 3 times the size of, comparatively on the other side of my face. And I was just at absolute agony. It was probably some of the worst pain I've ever experienced. And so they had to quickly get me up there, and they had to biopsy that infection in my cheek. And so that means that they had to cut out the infection site and test it. They couldn't put me under anesthesia just because the timeline with a lot of tests that I was under, like bone marrow biopsies, to test my bone marrow to make sure that the cancer was responding. They put me out to do that because it's a very invasive procedure. I mean, they're sticking the largest caliber needle they can directly into your head bone. Not something that you particularly want to be conscious for as they do that, as one can imagine. But they were telling me that it would be a big risk if we put you under again after you being under so soon. So we could do that, but the safer option would be just to go in with local anesthetics, completely numb the cheek, and have you be conscious during the removal of the said infection site.
Wow.
And I opted to play it safe. And so me and this one nurse, she was so sweet, seriously VIP for sure, because for her to volunteer to do that and what was going to follow after, like neither one of us was having a good time, sure, with that situation, So she numbed me, placed an instrument in my jaw to make sure that everything stayed up. And I didn't feel any pain, but I did feel every ounce of pressure from the scalpel. Every ounce, the sound in my head, everything. I mean, that alone was making me sweat and uncomfortable enough as it was, And the whole reason why I'm telling this story after we were finished is that she asked me if there was anything that she could do or there was anything that I needed. And I told her, would you mind giving me a minute? And she was like, absolutely. Do you want me to dim the lights for you? And I was like, please. And so I was sitting there laying on this inspection bed. And that's when the reality of the situation I was in really hit. Where it was like, okay, this is what life is going to be like for the foreseeable future. And we just made it for the first month of the 3 years that they had me signed up for. And that was the introduction of the experience. You know what I mean? And in that moment, I was already exhausted from being on the chemo for the short period of time that I was. And then after that experience, I was already spent. So I was very much in a position of, how does anybody, and I was asking God this too, how do you expect me to see this through? How? I don't see it. And so I remember offering up a prayer to him. And it was one of the really important lessons I learned during that time of the idea of radical acceptance, which is if you ever want to try to change something in your life, transform, make any headway towards addressing anything, you first have to accept fully, completely the position that you're in first and foremost. All realities of it, all the facets, and how it's affecting you. Then and only then can you make any leadway or headway with anything, right? And that wasn't only applicable to that such of an extreme set of circumstances, but that's with you're faced with any sort of adversity.
So when you say totally accept the situation you're in, are you saying to abandon thoughts or feelings of like, oh, things aren't actually as bad, or can you explain?
Yeah,
Accept your situation.
yeah, so absolutely. So in that situation, it was the radical acceptance of, and it was very much in the prayer that I offered up too, where it was like, you know, God, I be completely honest with my feelings of where I'm at. I'm spent enough already as it is. I didn't even ask him to be like, please keep me, alive, make sure I survive and get through this. It was more along the lines of, let thy will be done, And so accepting the fact that I might survive this experience, but I also might not.
This is a prayer you offered while like laying right after the surgery. That real.
Well, it was me completely handing over my life to him in that moment, because I knew right then and there that was a very in my face example of my hands are unqualified to handle this situation 100%, right? And so that's what I mean by the radical acceptance of things, where it's accepting that I have cancer, I am in this situation, and I'm in it for the long haul. I might live it, and I also might not. Let thy will be done. If I'm supposed to be here for whatever reason, you have me to stick around, then have me stick around. But if it's also time for me to come home, I won't object. Well, And so they kept me there for a couple of days to monitor me, make sure that the infection and everything cleared. And when you're immunocompromised, the only thing that they can give you is just a ton of antibiotics, because that's the only line of defense that you have, right? No immune system, just give you antibiotics, right? Just an absurd amount of antibiotics. And so they kept me for a couple of days to monitor me, to make sure that everything was cleared out. And it was the eve following the day that I was cleared to leave primary children's to go back home for a week. And that's how that first year of treatment went, whereas I would go in on Mondays, they would give me a chemo transfusion, and then I would have a week to recover, bounce back, have the numbers just come up high enough. And by my numbers, I mean my blood count and everything, just enough to where they could knock me back down again. Right. And so it was rinse and repeat for a year.
Dang. It's almost just like getting beat up and healing, and then getting beat up and healing.
Exactly. It was crazy. Exactly. But the eve of that night, that's when I had a dream that night, and I usually don't share this because it's extremely personal and sacred to me, but for the purposes of this story, I cannot tell it, because it really redefined my faith, and it also showed me pretty clearly my standing with God, because you read in the scripture stories all the time about these great men and these individuals who just go through the worst of times, and time again, they always end up being the same way, but they end up being delivered, and somehow, some way, God follows through. right? Because that's what makes God God, is that he follows through with his word, right? And that dream that I had, I I think I take it much more than a dream now. It was more like a promise than anything else. Um, I remember pitch dark. I couldn't see in any which way direction. Um, but I do remember feeling sand underneath my feet, in my hands, and I could hear waves. So I could surmise out on a coastline. Um, but I just remembered feeling so hopeless, and everything was dark, and it was almost suffocating. It was hard to breathe, you know. The thoughts and feelings were rushing through my head where I was like, this is it, isn't it? I am not going to live to see my 20th. You know, it was thoughts and feelings like that. My prognosis was not great. There was about a 68% chance of fatality. So the oncologists at Primary Children's, they did a great job of keeping things optimistic, because mindset in the face of such adversity really is important. But my odds were not spectacular. They weren't. And I just remember really sitting in that dread where it was like I didn't even get a chance to start. No chance to even start living. And that's when light started showing up in this really dark place. And it was a sunrise. Slowly started to rise above the horizon, and that's why I just saw this vast sea stretch from horizon to horizon, just endless. And as the sun continued to rise and started to warm me up from that dark place that I was just in, and it gave me the courage to stand, and I started walking towards the water. And as the sun continued to rise, I felt this hand rest on my right shoulder. And in the moment that that hand placed itself on my shoulder, a stone pillar started to rise out from the water. And I heard a voice. It wasn't of any specific or discerning tone or anything like that. It was just calm. And it told me that the road before you has been paved. All you have to do is have the courage to walk down it no matter what. And after those words were shared with me, I stepped on that stone that rose up, and another one began to rise, and another one began to rise, and the dream ended. And so, looking back at that now, and I knew it then, but I'd had a long time. I mean, I'm 6 years in remission, so I had a long time to reflect on all the events that happened and leading up till today. That was a promise from God telling me that, hey, you will make it through, but you have to have faith in me to walk down the path that's been paved, no matter what. And that was a tall order, because there was a lot of complications that happened during treatment. That was just one, and that was the least severe. And so then that's what I mean by, faith and miracles. They're a very real thing, and they do happen. You know what I mean? Especially if you go and ask for them. And they usually show themselves when you're at your lowest, and we can't ever ask for the things that may happen to us, but we can only control how we respond to those things. So after that night, I woke up that morning knowing exactly what I needed to do. I needed to follow through with the treatment plan that these team of medical professionals laid out for me, and no matter what happens, to continue with treatment until it was over. And that's what I proceeded to do. Um, and that first year was definitely the worst. And when people ask me about 2017, it was definitely the year that crawled itself seamlessly out of hell to just personally get at me from every which way. That year, not only was my micro life falling apart, so with my health and everything, but my macro life was also very turbulent or falling apart too. It was the same year that my parents' divorce got finalized. And so there wasn't a whole ton of support in the areas where typically you would be able to find if you wouldn't have gone and looked for it in those places. They simply just weren't there, man. And so I had to lean completely and entirely on my faith and on that promise to see me through that experience. And so it really rings home true where the scriptures say to make sure that your foundation is built upon sand and not stone. Because during that time, everything got blown away. The winds completely took it, except for that stone-like foundation of my belief in God and Jesus Christ. So that was a relief to see that, okay, I actually did nail something correctly with the foundation. That's good to know. That's good to see, right? But the trials kept coming, type of a thing. And I, along with that same year, like I said, there was several other medical complications. One of the biggest ones was a side effect of one of the more intensive chemotherapy drugs they gave me. I actually ended up stroking.
Oh.
On the left side, and I lost functionality of this right arm for months. I was in occupational therapy, and they worked really diligently with me. And I mean, you can't even tell today, but it was extraordinarily hard. And so it was a big lesson in resiliency, for sure. And that sort of a thing. And then senior year roll around. This was all before senior year. This was the months. This was during the summer in between junior and senior year. All this stuff happened. But I was able to. They cleared me to be able to go back to school, and I was sick and tired of sitting in rooms by myself because of being immunocompromised and everything. So I was excited to go back to school and engage with other human beings instead of medical staff, right? And then all that type of stuff. But senior year was extraordinarily tough. It was probably the most alienating experience I have ever felt to date. Alienating in the fact of one of the things that I became acutely aware of and noticed was, and granted, it was the grade that we were in. We were kids. You know what I mean? The individual that I was in a relationship with during that time too, is we were just kids. We were doing the best that we could with a overwhelmingly impossible set of circumstances to deal with.
Yeah.
But it felt like with certain interactions that I had with some of our, classmates and even some of the adults, it was very, people all of a sudden forgot how to talk to me, how to even approach me, knowing what it was I was going through, and
I know the picture you paint.
yeah,
What it was like.
yeah, and it really did get to me for a long period of time. There's all of us in humanity. It felt like I somehow got sawed off and I was just separate from the rest.
Yeah. Well, and like you said, this is such an absurd and unique story. And I think, I don't know anybody who's ever been through something like this. And I think, especially as teenagers, it's like, oh, look, there goes the guy who had all these crazy things happen. Like I get what you're saying is you're a spectacle. It's not in a great way. And the way people interact with you is just weird. Like I get it. So that'd be even harder. Yeah.
No, for sure. And it was because it was one of those things where it was like, despite it all, still me, I'm still human. I'm still steel, you know. But there's that idea where it's like people would show up more for the cancer instead of the person behind it.
Interesting.
Very interesting. That's how it felt like, and oftentimes I had people come up and tell me where it was like I wanted to say something but I didn't know what to say, so I didn't, and so I just chose not to interact, which is a common thing to happen not only with just my set of circumstances but anyone that's going through anything that is severe. We have a hard time. We get caught up in our heads about, I don't want to say the wrong thing. I don't want to, so I dare not approach. It's like, how do I approach something like that? Like, what words could I possibly put together to possibly match the scope of the difficulty that they're going through?
Well said.
Right.
And what would your advice be to that, to people who,
Yeah, absolutely. So, first and foremost, the most important thing that you have to realize is that, and there are some circumstances, there are some trials, hardships, where words are just going to fail. There's no way around it. There is no way to accurately articulate certain disasters and catastrophes. There just isn't, right? And so my advice or recommendation, I guess I would say, instead of trying to cobble up the most perfect, poetic, grand epic that you could try to muster to make some profound impact on somebody, keep it simple. The most impactful moments that really hit home for me when I was going through what I was going through was the simple, hey, I see you and I'm here for you. Usually followed by physical reassurance. So a hug, a hand to hold, a hand placed over a shoulder, letting them know, hey, I can't possibly know what it is that you're going through, but I'm here for you regardless.
that's great advice. Yeah. For anybody who, because obviously most people don't go through these kind of things themselves, right? And so for the rest of us who don't go through it, how do we interact and how do we, because you said words can't do it justice, words are going to fail you.
Right.
Your advice is keep it simple. Don't say nothing, be simple.
Right.
I see you, I'm here for you. Physical reassurance. That's fantastic advice.
Absolutely. And then that's really it. At the end of the day, we tend to overcomplicate things, and I get it, especially when it's someone who's really is dealing with dire stuff. And you can feel how daunting it is. You can't. It's like a mountain carved into a blockade. It's like, how do we even begin to approach this, right? Show up for the person. Show up for the individual that they know that they are, not what it is that they're going through. That is how you can make the biggest difference and the biggest impact.
Love it. That's awesome.
So, yeah, so senior year, I showed up whenever I could, whenever I felt well enough to do it. I was still very much going through active chemotherapy and everything. There's the difference between the intensive rounds and what they called maintenance treatment, which was what allowed me to go back to school, was the chemo and the medication that I was under. I didn't need to be surveilled by a medical team. So it gives you a little bit more leeway. It gives you a little bit more control back into your life. You're still under the effects of chemo, but you're no longer on the stuff where it's like, okay, just in case if you go into sudden organ failure, there's medical staff on site that can address that.
Right. It's still heavy and serious, but you're not living in the hospital anymore. You're able to, I get you.
Yeah, absolutely. Um, and so, but I missed a lot of school days. I went from, pretty solid GPA student that was there consistently by barely graduating high school by the skin of my teeth type of a thing, But everyone, like especially the school staff, they were all very accommodating, and they made sure that I was going to graduate, and I did, which is a monumental accomplishment considering everything. Yeah, dude, and so the next 2 years, and after graduation with high school and everything, it was like I said, I had to pivot. I couldn't go to university. The side effects of the treatment on my body, it was just too much. The chronic fatigue, the brain fog, they often call it chemo brain, right? Where it greatly disrupts cognitive thinking, so focusing, that sort of a thing. And then the damage that it did to my nervous and connective tissue system, since it destroys rapidly dividing cells, that's why people's hair falls out, your nails stop growing, muscle stops building, bones stop growing. You run a real risk of brittle bone syndrome, and that sort of a thing, where literally, your bones are being devoured by the chemo itself. So there's so many complications and things and variables that you have to all of a sudden worry about. And some of these things linger on 8 to 10 years after treatment is over. And so it's a lifestyle change that you have to make. I don't approach food, exercise, really anything the same because I don't have choice. Right. But I was able to find a foothold, get my foot in the door as a phlebotomist, which led to me being a medical assistant for a while, which wasn't super strenuous physical work, and I learned a lot. It further cemented my love for the medical field, and that I knew that that's what I wanted to go into. I had my specific plan, but life throws you curveballs, and so you have to just adapt, and it was like, okay, doctor, nurse practitioner, maybe I can't do that, but that doesn't mean that I still can't engage in what I want to engage in. And so I did that for a little while, and then I ended up working in behavioral correctional facilities, working with troubled young men for about 4 years. And somewhere in between that timeline is when I finally finished treatment, which was a monumentous day, where you get to ring the bell and everyone's there celebrating for you. And
Wait, what do they do? I didn't know this. So, like, when you finish, is this like specific to some like the Salt Lake cancer?
it's actually pretty common for anyone who is lucky enough to say that they survived their cancer diagnosis. So they have a bell on the oncology ward, big old thing that you can ring proudly. And I forget exactly what it says, but there's a plaque above it where it basically summarizes how long and hard the journey that you embarked on just was. But, when you ring this bell, it sounds your newfound freedom in your life back, essentially is what it is. So it's a whole ceremony that they put on for you to celebrate the fact that you made it.
I don't know any of this. That's very cool.
Wow, right? Yeah, that you beat the odds. Tumultuous odds. Statistically speaking, should not have, but you did. Right? Absolutely. There's not cause for celebration. I don't know. If that's not cause for celebration, I don't know what.
Right.
Okay.
It's awesome.
And so, did that, and I was riding cloud nine, there for, a while, not gonna lie. However, the other thing that was lingering in the background was life still happened during those 3 years, right? Body, mind was completely focusing on just surviving the next day, surviving the rounds of chemo, all of that. All energy, resources, all of that were just put into that
that bank of things. But a lot of stuff happened during those 3 years. Like I said, my parents' divorce, relationships that were really close to me, unfortunately, they didn't work out. Separating of friends, whatever may have you. All of those things. And it also was also the effects that going through such an experience had not only on my conscious mind, but my subconscious mind as well. All of that came flooding to the surface the moment that my brain had the energy to focus on that. Because you can only put things on the back burner for so long before it comes forcing its way for you to deal with, right? Don't sweep your dragons underneath the rug because they're just going to grow, right? And then they'll grow so big that one day you have to acknowledge them. And usually by that point, they've gotten so big that they can devour you, type of a thing, right? So
Go out and slay your dragons when they're young, right? Makes it a lot easier to deal with. Major anxiety, and I've never experienced anxiety before, not even during treatment.
Yeah.
And that was God's grace working through me for sure. Like I said, because I knew that I was being carried throughout that experience, even though regardless of the complications and how painful and agonizing it was on my physical body, I knew that I was being taken care of, right? I had no idea what was waiting for me life after. Integrating life after was not as simple as ringing the bell, celebrating, and then just picking up right where you left off again.
Well, right. Because this happened in high school.
No, and during very informative years too, And so that was the thing that took me by surprise the most, was debilitating panic attacks every day, relentless, unforgiven, the insomnia, the sleep paralysis, the night terrors, all of these things just coming out in swarms, and not discrediting or bashing any of my, the oncology staff or my medical team, but I had no idea. I was like, is this part of the process? Because no one gave me a heads up about any of this. You know what I mean? And come to find out that it was post-traumatic stress, something that I'm still wrestling with today, something that I'm still actively working on. Right? Because after experience like that, anything that the brain perceives as trauma, 100%, right? It's your brain that goes out of its way to try to build a map for your life and tries to set specific land points and landmarks. And after you go through a traumatic experience, and all of a sudden punches holes in that map, and your brain doesn't know where the holes are. So it's on constant high alert. That fight or flight, that parasympathetic part of your nervous system is always on, or it's always hyperactive because it's looking for potholes, but it doesn't know where they are, right? And so you're in this constant state of panic, right? There is also the whole wrestling with the fact that relapse is also a very real part of my life as well, where I might be 6 years out and my chances have greatly decreased, but there's always the risk that it will come back. And so all of a sudden I had all these things that I had to reconcile with. And therapy is very important, folks. I highly recommend that, you get on that sooner than later.
I really wish that I would have, because going back to the dragon comparison, would have been a lot easier to deal with and slay if I got on it a lot faster than I did. Absolutely.
But we're making great progress, I'm happy to say.
So we're talking about life after, you ring the bell, you're cancer free. Life is still way hard for you immediately, right?
Yes.
How long post ringing that bell are we talking right now?
So we're talking, most panic attacks set in about probably a week after.
Okay. So for sure,
it was quick. Yeah, and a few misdiagnoses here and there as far as my anxiety goes, which is something that
happens way too often, where there's a big difference between someone who just has general anxiety disorder and then someone who has post-traumatic stress. 100%. You know what I mean? You can't treat those things the same way. And so it's been a long journey to try to just simply heal again. Pick up the pieces that can be salvaged and then learning how to let go and abandon the rest. God has been working very close with me, shoulder to shoulder, to try to make amends with those things. And so I started looking into other means of medicine.
I see. Right. This is where the holistic medicine
starts to keep part of your life. Yeah, starts to bleed in a little bit. Yeah, because I dove a lot into Western philosophy, right? Like studying all of about cancer and chemotherapy and all the hundreds of medications I was on during those 3 years. I felt the full force of what the extreme side of what Western medicine had to offer. And I was always thinking to myself that there has to be something more that we could be doing. There's another facet here that we're ignoring that is desperately crying and screaming for help. But I don't know what it is. I can't recognize it. I can just feel it, right? And so I started studying Eastern philosophy of medicine and how looking more into the body as not only addressing the physical and mental body, but also addressing, the health of your soul and how they're not separate. They're all one and the same, right? And that's why they call it the holistic approach, because you're looking at the body as a whole, right? And that really intrigued me, not only for, the sake for myself and what I could possibly learn to help me recover, but I also saw it as a huge opportunity to give back to all of the people that helped me and quite literally be given a second chance at life. It felt like it would be extraordinarily wrong to not make an effort, a real solid effort to give back and to help others on their healing journey. Because if it wasn't for those good folks that helped me along mine, I wouldn't be here. And it really pushed me further to want to be in a position where I could be of assistance, where I could make an impact, no matter how big or small, as long as an impact is made. That's all that matters, right? And so I learned more and more, and then that's when body work, massage therapy came into my periphery, and it just felt right. It was like puzzle in front of you. You're missing that last piece. You finally found it, and it clicks, right? And I found a school fully accredited. They accepted financial aid and everything. 1,000-hour program that I got done within a year, and I learned so much about the human body and learning how to heal people through tactful touch and connective tissue manipulation and muscle tension release, and how much of an effect it has not only on the physical body, but also on someone's mental state as well. It absolutely blew my mind just how impactful it has been. And with massage in general, it's what makes it so effective and so efficient as a healing modality is that, and I'm just a firm believer in this period, where if you truly want to heal from something, you have to allow yourself to be vulnerable, right? That's a very important aspect of healing, right? Or anything meaningful, anything honest as far as engagement. If you want to push something, right? If that part of that equation is the radical acceptance, accepting completely where you are and how it's affecting you, you then have to allow yourself to be vulnerable enough to express, share, show your wounds, express your hurt, so that somebody can help you along the way to mend, right? And massage therapy, it's a intimate setting in the sense of it's just you with a stranger for at bare minimum an hour, at most 2 hours, and they're coming to you with their pains, their aches, and you really and because of that intimate setting and you're spending, that amount of time with them, it gives you a real chance to not only address the physical pain that they're dealing with, we also get to hear the story behind it. Yeah. You also get to get that really important piece of context that a lot of people just simply don't have the space to express.
So you're really talking with them as you're working and massaging. Okay.
Absolutely. It's a space to make people not only to be heard, but to be seen.
I'm sure they're very vulnerable in those moments with you as you're healing them.
There they are. And that's where the magic of the work comes from, right? Because when you are inviting somebody into a vulnerable space and you know that you're entering the vulnerable space and it's deemed safe, that is where the capacity for our level of growth and healing can take place the most, is when we are at a vulnerable state. But the opposite can also be true, right? Because by definition, something that is vulnerable is something that can be hurt and wounded, right? So you have to handle it with nothing but the most tact and respect, honor. I go so far as to say you treat them as it's sacred, because it's somebody that is coming to you in the most vulnerable way, and they're asking you, will you please tell me? Yeah. It is, in my opinion, one of the most honorable things I have ever chosen to do in my life. That's so cool. And it has brought me so much meaning, and I thank God every day that I am alive.
Dude, I don't know how many people out there really feel that way about what they do. Like, probably not most people.
No, I consider myself very lucky and blessed, not only on that front, but obviously everything I eat. There are so many important lessons that I learned going through my experience. So many. But one of them was to really, and you hear this all the time, but when you're at death's door, it really, it hits different. And that is to not take anything for granted. Not one thing. The fact that you can wake up in the morning and draw breath. The fact that, food doesn't taste different anymore. I appreciate them a lot more. Just simple, easy days, like I'm able to move my body the way that I want. The fact that I'm able to think clearly, that I'm able to engage in the ways that I want to engage in. All the things that in high school, yeah, I probably did take for granted often, you know what I mean? But now this paradigm shift that's been given to me is no longer the case, because this life is by every definition a gift, one to be cherished, one to uphold, and one to honor, even despite some of the terrible things that can happen. And that's why they say life, it's the great and terrible story of a lifetime.
Yeah.
You know what I mean? And you take the good with the bad, and you really appreciate the good times as much as you can while they're around, and even try to find ways to be grateful for the bad times too, and try to change the mindset of, okay, what's the lesson I'm supposed to learn from this? What's the point?
Yeah.
And that's where I feel like it's important to keep God in the equation, because it's all up to you. At the end of the day, this life is. It's all completely out to you. But you can add that other equation to it where it's all up to you with God's guidance. That makes it a little less daunting of a statement. You know what I mean?
Yeah.
And so I'm not grateful that, I got sick. I mean, obviously, it was was a very harrowing time, and I'm still dealing a lot of the aftermath of the afterwards. You know what I mean? But I am very grateful for how I've grown and and the things that have taught me and the person that had made me today. You know, being able to empathize with others has been really the biggest thing, where when someone comes and sees me, or if I'm even just talking to a friend or a family member and they come to me and they tell me I'm hurting, I know what that means.
Yeah.
You know, so I can say, I know. Let's talk about it. I see you, you know, and that statement, that I see you in the midst of that, because when someone's going through something really harrowing or those types of experience, the last thing that they're feeling is, I'm being sick. I'm a burden. I am even embarrassed that I'm going through this, you know, the whole gambit of things that we tell ourselves. And to take the time to set aside the space to tell people it's okay. I see you. Let's see what we can do, you know. Love that. And it's very, very powerful.
Yeah.
One of the most powerful things ever that I've ever learned, you know, and it is such a gift to have been able to have learned that at the age that I have,
Yeah.
you know. So
Yeah. It's so cool hearing your perspective on this. And thank you very much for sharing all that you've shared so far. You're vulnerable. This is fantastic.
You're very welcome. I appreciate your providing the space for me to be able to do so.
100%. This has been great. So, we talked a little bit about advice you would give for people, how they can interact with someone going through something very hard.
Yeah.
What advice would you give for people going through hard things?
Yeah. No, that's a good question. The advice that I would give, if you really find yourself going through a really difficult spot where you're feeling hopeless, helpless, but there is no way out of the dark tunnel. One of the biggest things that helped carry me was believing that whatever overwhelmingly huge obstacle that was in front of me, believing that there was something so much bigger behind me that would triumph over anything that ever came to face me, helped me tremendously. Right. And again, circling back to my faith, you know, the faith was really the cornerstone of what got me through. And I understand that not everybody may believe in the concept of God or a higher power and that type of thing, which I totally respect and understand. Everyone's spiritual journey is different, and it's supposed to be different by design, right? And you have to respect it instead of try to understand it, you know, because people's life circumstances are so different, and you just never know what someone's going through or where they came from, you know. And so, well, but bearing all that in mind, having even just the modicum of faith that no matter what it is that you are going through, that there's something fighting for you in the back line that's always going to be bigger than whatever it is that you may be going through. Even if it's something that's not really cleared or defined, you are so loved and cared for beyond all comprehension. That may be really hard for some people to see and to understand, but it's so true. And it has the way of presenting that self to you in the ways that you least expect it, you know. Your life is absolutely worth fighting for. No matter what it may be that you're going through, no matter what people may say or don't say, your life has value. Value that is so incomprehensible that you have a responsibility to fight for.
That's great. Thank you.
Yeah, you're welcome.
you mentioned earlier, a quote from someone I don't remember. You said, the two greatest moments of the day you're born, that you find out why you're born.
Yeah.
And you said for you, understanding holistic medicine and massage therapy is that for you. What would you say to people out there who have not found that, who are searching for it and hoping that they find that?
Yeah. Oh, that's another good question, because I went through, and this is common, it's human nature, where it's like at some point or another where we always think to ourselves, what's my thing going to be? Am I ever going to find it? Am I ever capable of ever being good at anything? You know what I mean? Like we all go through those thoughts, and that's the natural part of searching, or at least yearning to search. Those are natural questions that you're going to ask yourself. And I'm not saying by any stretch of the imagination that I have everything down pat and perfect, because I certainly do not. But if you haven't found what it is that you're looking for, your calling, as it may be put, make no mistake, we're all called. You're called to do something. If it hasn't presented itself to you, you're still called. And I'm a very firm believer, as long as you are actively striving and trying to find what it is, whatever that calling may be, it will find you. You will find it. It took me several years until I eventually found my niche, but I never stopped actively working for it. And then it was found, and I believe that opportunity is available for everybody. No one is exempt from that. So if you haven't found it, keep looking. Just keep being persistent with it, and you will eventually find it. That's awesome. Why not? If you're serious about finding it, you'll find it.
Thank you.
Yeah.
How about you mentioned, going through all of these traumatic things at a young age, and how you said, I can't tell the story without linking it to my fate, because it's been so big for me. And
Yes.
I feel Carrie, it's always been a major part of your life and stuff. I feel like most people in super traumatic or high stress situations, it either removes them from their faith or it strengthens their faith. For you, why do you think it strengthened your faith?
Because I allowed it to. And I know that sounds super simple and easy, but when you're down to the wire, it really is just down to, what decision am I going to make, right? Adversity, I view nowadays a lot like kindling for a fire, okay? And so we all got this inner furnace burning with us, so to speak, right? And so when adversity comes our way and the kindling starts to burn, you can either actively make the choice to allow it to burn and fuel your inner furnace to allow you to grow, or you can allow it to burn you to the ground, right? So it is really just having that growth mindset. One of my favorite sayings of all time is that I have no control over what may happen to me, but you will always have complete control on how you respond what happens to you. Always. And so with my situation, my faith grew because I wanted it to grow. I wanted it to use it as an opportunity to build me up, despite all signs and flags telling me the opposite was going to be true. And it is often through the hardest moments that we go through is when we grow the most. The book of Matthew says that pretty explicitly. When we're at our lowest is usually when God works through us the most. But that's a choice. You have to allow that to happen. You have to soften your heart enough to allow growth to take place. right? Because you're absolutely right. You can allow the opposite to happen where you can become resentful, spiteful, even of why did you allow this to happen? I don't get it. Am I truly not favored? You must be a fraud. The whole enterprise must be a fraud, right? You very easily could take that direction. I just don't see, especially if you do make it out of whatever it is that you're making out of. Because again, my example is probably one of the most extreme ends that you can go to, right? Most people exist within the gray, right? There's a pretty good chance that you're going to make it out of whatever it is that you're going through. And depending on your attitude and the choices that you make and the decisions you decide to take, mindset you decide to adopt, it's either going to it will reform your character, depending on if it reformed it in a good way or a not so good way. That's on you.
It's a great answer. Love that. How about, I mean, I know we are still young, right? We're still writing our stories.
Yes, absolutely.
What do you hope to accomplish in your life?
Yeah, absolutely. So I want to be able to continue to help people, but on a much bigger scale, on a more personal scale. I would really love to really solidify my practice and to make a name for myself in not only as a massage therapist, but as a practitioner, right? Where it's like, if you hear about my name, it's like, yeah, he'll take good care of you. You know what I mean? That's a really big goal of mine that I want to accomplish. Obviously, having a family, finding, my person to build life with as well is also another huge goal of mine as well. And to just live life fully and to never take it for granted like I did again.
Love that.
So
That's great. If you could go back in time and give yourself advice, what point in time would you go to? What would you say?
I'd probably go back to I would go back to the beginning of my senior year. And if I could pull myself to the side, I would tell them, hey, there are people that you really care about right now that are going to say some things that you never thought they were going to say. Okay. And it's going to hurt, right? But you're also going to have people that you never thought would have your back, and they're going to show up for you. So really pay attention to the people that choose to invest in you. And it never really mattered what the things that those people are going to say never mattered. Then that's what I would tell them.
I'll with that. If you don't mind, I just can't imagine people saying, well, what kind of things were said to you? Like, I mean, you're a cancer survivor. What are people saying to you that's...
Well, as you see, James, and that's the thing about it, where it's like, that's like you said, it's when people are, faced with certain things, you would be surprised about how weird people get about it, simply because they just don't know how to approach it. They don't know how to approach you, and like I said, and that's where I said before, it's like, make sure you're showing up for the person, not what it is that they're going through. Because depending on that interaction, if you're showing up for the thing instead of them, that is going to greatly dictate how things get said and what things are said. Right? I see. Exponentially so. I've had, instances where I've had people tell me where they, really solid in my life before, but then after it was, that distance that takes place where it's like, okay, I get it. You may not know how to, it's scary. I understand. Right. But I've had things say where it's like, I think you could have, handled it a bit better. I've had people tell me, I just don't know how to interact with you anymore because of the fact that you have cancer. I just don't know what to say. I've had people that just simply try to make jokes and make light of the situation because in their mind they thought that that would be lightening the mood type of the thing, right? And I don't harbor any ill will towards those people, not at all. And especially at the time frame in which it took place and the ages we were kids.
Yeah.
Okay,
It's still hurtful though. I get it.
yeah, but it's also such a thing that completely is just it goes over your head because it's so big. You know what I mean? And so that's but those things, have definitely been said. And you're right, it does hurt. It does because it's one of those things unless someone really goes out of their way, and this is why empathy is so important, right? And there's a big difference between empathy and sympathy, right? Empathy is you notice that somebody is in a deep dark place, right? You notice the hole that they're in. Empathy is when you go down in that hole with them just to merely sit and acknowledge, again, allowing them to be seen and being like, wow, this really is a dark place that you're in. But I'm here for you, though. So I'm going to sit in this space with you for a moment. I can't stay here forever, but I'm more than happy to sit in this space with you so that you're seen and heard, that you're still a human being despite the grief that you're going through, despite the horrible thing that happened, the unexpected loss. You're still very much a human being just as I am, right? And that's evidenced by the fact of me being willing to be here with you, right? Sympathy is when someone walks by and sees the hole and they're like, man, that really sucks. Do you want a sandwich or something that I can toss down for you? Right? You see how it's complete disconnect from what's a genuine human interaction, while the other one is more of the passive observer,
Right.
where it's it's easy for them to say what it is that they want to say or whatever comment they want to make because they're not down. They're not willing to go down and meet you where you're at. They're like, I'm safe up here. It looks terrible down there. So I'm just going to stay here. But people get it confused where it's meeting people down in that place doesn't mean that you are planting up residency there. That's not your job, right? It's still very much their situation, but you can still show up for people. That's in my mind what it means to show up, right? Where it's I acknowledge the place that you're at. I can see it. I'm here. I'm with you. Don't forget that I'm with you. Because that, given some people's circumstances, that could be make or break.
Yeah.
That's great, man.
That's great. So, something I just thought of. What year was it when you rang the bell and officially beat cancer?
Yeah, so it was 2019.
2019.
I mean, I was the tail end of 2019.
Okay. I was just thinking, so you beat cancer, and COVID hits.
Yes, sir.
What was COVID like for you?
So COVID was, and actually, I consider myself pretty lucky. I was in a great relationship during that time, and so she was able to provide me with company and comfort, and we were able to ride that that wave together. So I wasn't alone or isolated or anything. There was huge pressure as far as to get vaccinated, and I'm not pro or anti-vax or anything. I just, it didn't feel right given with my mental. I didn't want to risk a potential another thing to have happen.
Sure, there's already so much chatter about it, and you just beat cancer.
Right. I was not willing to risk another thing. So I was playing it super safe.
Yeah.
You know what I mean? And it all turned out fine, and I know that isn't everyone's experience or everyone's opinion on the matter, but that's how I felt during the time.
Very understandable. That's great. Yeah.
Interesting. So COVID, it was hard on different levels, obviously for everybody, you know what I mean? But as far as my health goes, it didn't negatively impact anything.
Good to hear. Okay. Yeah, I know some people have it worse than others, immunocompromised? I was wondering if.
Oh yeah, no, I was very. This is going to be a crazy statement. I was very lucky to have ended my treatment when I did, because I could not have imagined going through chemotherapy and also the buzz during COVID, especially during those early days. Yeah, I've heard stories about other cancer patients that had to go through that, and man,
It's already a crazy bad situation. That just makes it.
yeah, exactly, exactly. So, I am very grateful for how my story played out, despite everything that happened.
Great. Well, I'd like to move it to some lighter things. Get to know you at a lighter level. So, what do you do for fun, man?
Yeah, so I'm a big outdoorsy guy. I love going on hikes, anything with a trail, really. I'm hitting it. I'm a very active guy.
Were you always into these outdoorsy things, or do you think it was just because you were locked up and kind of couldn't do a lot during your cancer treatment?
Yeah, so I was always very active in high school. I mean, anyone that knew me, even monically, I was always doing something. I was a year-round athlete, type of a thing. Exercise has always been really important. That definition of importance obviously changed when I learned more about the human body, like I did, where it's not only pivotal for your health, it's a prerequisite if you want to live a long, happy life. You know what I mean? It's just a must, but it's always been the biggest and the most reliable outlet for me to have to just vent and to get, things out, and to also just feel better and more confident about myself. That was one of the things that I desperately missed a lot when I was going through treatment, was I wasn't able to exercise very much because the treatment completely atrophied all of the muscles in my lower limbs, and I had trouble walking upstairs and getting out of bed by myself. I was in physical therapy for a year just to get me to the point to where I could run like a normal human being again. So again, it's one of those things where I just will never take for granted again the mere fact that I can go into the gym and simply do a workout.
That's awesome.
Yeah. But as far as like with the trails and everything, I have definitely with hiking and running and just walks type of a thing. Definitely have enjoyed being out in nature more. There's that very grounding energy that it does for you. That get you out from the noise and the millions of things fighting for your attention. Nature has become a big sanctuary, not only for myself but for a lot of people.
Both.
You know what I mean? And that's a big recharge as well. I love, playing anything with a ball. You know what I mean? I love to read. I love reading books on psychology and of all sorts, relationship psychology, human psychology, all those different types of stuff. I love to learn, and those types of things really, really intrigue me. So yeah.
How about you play video games still?
I do, yes. I am a giant nerd. Very big nerd. I've been gaming since I was 4 years old. And it's something that I still love to do. Yeah, I figured, if childhood me enjoyed doing those things, where it's like, well, should probably keep doing those things. Yeah, for him. Not to the same extent, of course, but like still.
What are your top 3 video games?
Oh man. I love the Legend of Zelda series. Twilight Princess is definitely up there for me, for sure. More recently, that's coming out, Expedition 33 has been a phenomenal time. And of course, you can't beat the classics like Halo, specifically Halo 3. Yeah.
Halo 3, okay.
Yeah, man, really a pivotal time in my timeline for sure.
Awesome, man. I've never played Halo 3, but I remember Halo Reach is what that's when I really got into a little series of franchise.
Halo Reach was amazing. It was phenomenal.
Yeah. That's so fun.
Absolutely. Yeah.
What about, was your necklace anything significant? What is it?
Oh,
dragon, or was it?
Yeah, so it's Nordic. My dad's side of the family, Norse. And so dragons, they just symbolize strength, resilience, bravery, that sort of a thing.
Dope.
So just something that
Looks
I
sick.
prioritize with. Yeah, so thank you. And I appreciate you for asking.
And I never even noticed this about you until you told me about that surgery on your cheek. Was it this cheek right here? Yeah, okay, show the camera both sides. They did a pretty good job because like you cannot really tell.
No.
Like looking at it.
No.
But like once you mentioned it and I see you talking, kind of see like a crease. It looks like you're like chiseled like, I don't know, handsome Squidward or whatever you know what I'm talking about. Like it's like Greek god type of chisel. So
Thank you,
but
sir.
I could kind of notice it now, but I would never have noticed that. They did a great job.
No, she did. She did a phenomenal job, especially considering very high stress, high stakes situation. I did not envy that nurse at all. That's a while ago. She was either, big sweetheart, which I'm sure she was, or she just pulled the short straw that day.
Yeah.
It's like, oh, Brand, I'll do it. But yeah, it's just, and it's in moments like those, not always so dire, but it's, you can really, that's, defines a lot of the human condition. You know what I mean? Being able to sit with people in spaces, not, obviously that's the extreme end of things, but just willing to sit with people, period. There's so much power in allowing yourself to sit with people and allow them to be seen for what they're going through at that moment and that time. It greatly enriches the connection that you can make with people. Yeah, maybe.
I agree.
Without judgment, without anything like that. Just purely seeing somebody who, and this is how I personally view everybody, or at least do my best to, where it's, we are all created equally in the eyes of God. And the way I see it, that's the only acceptable way to let him treat anybody. Yeah, dude. Like that. And it really enriches the experience and bridges gaps. I mean, that is the power to bridge gaps between people and opinions and, all that type of stuff that kind of mulls the water. But at the end of the day, we are all just human beings, regardless of what you've gone through, regardless of what you haven't gone through. And it's not a competition, right? It's not like my pain is greater than yours or yours is lesser than mine. That's not the point. Pain is pain, right? And the comparison is just, it's just not necessary, right?
It's not necessary. If there was a competition, you'd win. I'm glad it's not a competition, but
yeah. But no, it's just one of those things where it's like, if you're going to take the time to get to know somebody, get to know the good, which is the easiest part to do, but also the bad and the ugly. Yeah. Because that's life. We experience those things on a near day-to-day basis.
yeah, man.
So, and being able to feel like you can resonate and be heard on all those facets is truly being seen. And I do believe that is the point.
Love that, man. That's profound.
Yeah. So.
I have another question. This might just be my own ignorance, but is with chemotherapy. Yeah. Did you lose your hair? You've got a lot of hair, and so I was kind of wondering.
Yes, yeah. So I lucked out when it came to most patients, where I lost a lot of hair. I did. It got to the point to where I was just really careful with how I handled my hair, where it was definitely falling out. It did get to the point to where, like, after I got done taking like showers or anything, it was just clumps, right? I could just easily just pull it out. So I just let this. I was like, if it's gonna completely fall out and do its thing, I obviously can't stop it. You know what I mean? But I never shaved it. I just let it. I wore a beanie most of the time anyway, just because the spots were there. But no, I never ended up completely shaving my head.
Okay. I was just wondering if maybe you lose your hair, but the follow-up, the pores are still good, and so then it grows back.
It's interesting that you brought that up. So when people go through chemo, obviously because it's a radioactive substance type of a thing, it does tweak genes. My hair through high school was super straight as a board. But now when the parts of my hair that did grow back and when those new follicles did come back up, grew back curly.
Interesting.
I've never had curls in my life. I've also have heard stories and know of other cancer patients that the pigment of their eye color changed.
Wow. That's nuts. I didn't know that.
Yeah, so weird little things like that can happen.
Is there anything other that happened to you besides getting curly hair?
It was just the curly hair. Also, some of my musculature growth did get stunted, and also it did halt some of my height as well, just because it was, it was one of those things. Because at the age I was in, I was due for another growth spurt.
True.
The chemotherapy hit the brakes on that hard. You know what I mean? But again, when it comes to the whole rest of my life and that, semantics.
Good trade off.
Yeah, 100%.
That's awesome.
So yeah.
Cool. Well, is there anything else that you would love for people to know about you? I feel like you've gotten to share with us so much, and I appreciate all that. But I don't want you to leave anything on the table that you want to make sure people know.
Yeah. Well, I really, my biggest point today was to share my story, and hopefully it resonates with even just one person. That really was the whole point. And also, hopefully, I spread awareness as effectively and efficiently as I could. And I really appreciate you providing the space for me to share, my experience. And I know, it when I get talking about it, it sometimes feels like it's a lot. Because it was a lot. It was a big chunk of, my life and everything. But as far as other things, if you feel so inclined, come see me at Summit Medical Spa, located in Spanish Fork. I would love to help you in any way that I can. And come give me a follow on Instagram, just at SteelPM.
Okay, I'll plug that in. It's awesome.
Yeah, man. But besides that, that's really everything. But I cannot thank you enough for setting this all up.
Dude, I can't say you enough, man. This has been fantastic. I appreciate you being willing to share everything that you shared. So
Yeah,
you're the man, dude.
it was an honor, real honor, man.
You're a stud. Thank you. Appreciate you. Good for you. Well, good to see you, James. Thanks, man.